And that's one of the things I've learned throughout my medical career, the importance of loneliness as a comorbidity. You have to ask a person, are they lonely? You have to look at the quality of their social relationships. It's as important as checking their blood pressure.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. Today we're talking about loneliness with Professor Roger O'Sullivan, Director of Ageing Research and Development with the Institute of Public Health, and Professor Brian Lawlor, Professor of Old Age Psychiatry and Founding Director of the Global Brain Institute in Trinity College, Dublin. You're both very welcome to the podcast.
Thank you very much.
Thank you.
So we're talking about loneliness today, Roger, and this was one of your suggestions. I know we worked together for many years, but you said when I approached the Institute about partnering up around the podcast, loneliness is a very interesting subject. A lot of people are interested in it and trying to get a better understanding out there for people. So at the base point, what are we talking about when we name loneliness?
So just to start with, Fergal, I think it's really important just to recognise as a society, we've never had more opportunities to connect. And loneliness is an issue that's increasingly getting focus. Loneliness is a very personal issue. It's a negative feeling. It's a difference between what one wants and what one has. You could be surrounded by people and still feel lonely. So it's really important to remember it's very personal, it's subjective. Two people may experience the same thing and have very different outcomes. Maybe that a person has too few relationships or they're lacking the depth or quality that they desire.
Yeah, the depth and quality, that's an interesting point, isn't it? You've context, but the real into the word relationships is that depth piece, isn't it?
Yeah, that's the bit that's really important in terms of a relationship that you can have a close conversation with.
Yeah.
And meaningful, you can laugh with, those types of relationships that they can help at difficult stages in your life. That's what relationships, both the positive and the negative. But in terms of relationships, there's different ways to think about relationships. Some people think, friends for a reason, friends for a season, and friends for life. It's just a usual way.
Yeah, and I suppose we all want and need friends for life, or people that you can be vulnerable with. What's your take on that, Brian?
I think Roger was pointing out the importance of the different types of loneliness. I mean, you have kind of social loneliness and emotional loneliness. And social loneliness is where there's a lack of embeddedness and a feeling of not being integrated with the community, with your friends, with the group. But the emotional loneliness is this feeling of lack of a confidant, somebody you can trust, somebody you can talk to, that Roger was speaking about. And I think that's the more important type of loneliness, this deep emotional loneliness that can be very chronic and enduring. And to my mind, that's the form of loneliness that can result in poor health outcomes, increase your mortality, increase your risk of having high blood pressure, poor sleep disturbance, and really impact on your mental health. So it's important to distinguish between emotional and social loneliness. Oftentimes they coexist, they can co-occur. You can feel socially lonely and emotionally lonely at the one time. But in my view, and speaking from the point of view of a healthcare professional and dealing with people with loneliness and with mental health issues, it's the emotional loneliness that drives the lack of function and, to my mind, bumps up your stress axis, raises the cortisol levels, impacts on your inflammatory system. All of these things which have very poor negative outcomes from a health perspective.
So it has a mental and a physical impact. I suppose we know more and more now that emotional things are impacting on us physically, and loneliness, you're saying there, has key markers. I suppose it's driving chronic disease.
That's very true, and I think this is something that we didn't really know when I was at medical school. We thought loneliness was a social issue.
Yeah.
Not a medical issue or a health issue. But we know now that loneliness and the quality of your social relationships really does impact on your health, and probably through the stress axis and through inflammatory pathways and poor health behaviours. So loneliness can be very damaging to your health and increase your risk of dying. And a lot of people don't know that, not just the general public, but also healthcare professionals don't really seem to factor in loneliness as part of health or part of an assessment of health. And that's one of the things I've learned throughout my medical career, the importance of loneliness as a comorbidity. You have to ask a person, are they lonely? You have to look at the quality of their social relationships. It's as important as checking their blood pressure.
Yeah, that's interesting. I had a conversation recently with two colleagues working in emergency in Portlaoise, and they do an assessment with older people coming into the service. And they were really delighted having that space to get behind the curtain and ask the issues about what's going on. So they're really hitting on the social determinants which is it's still a very new thing in terms of healthcare and people's understanding of healthcare.
Yeah. Brian touched on social and emotional loneliness. And then there's a third one, existential loneliness. It's the feeling that even though that you have connections and friends, you feel disconnected from society. And it's a part that's not often thought about. It's the social and emotional is really important. Just in terms, we're talking about different terms. Social isolation is a term that you often hear. And sometimes people use the term loneliness and social isolation
Interchangeably.
But just in terms of, if you were to think it in very simple terms, loneliness is about the quality. You know, when you're looking at it, it's the quality of the relationships. Social isolation is measuring the quantity in terms of how many people do you have connections with? Do you live alone?
I think there is a misconception there. Certainly when I think of lonely, I think people living alone. That's kind of the first thing. You used the term in the conversation we had last week, Roger, of that old man living up the laneway. That's who I think is at risk of loneliness.
Well, if you live alone, if you are isolated, you are at increased risk of being lonely and feeling lonely. So they are separate constructs, but there are overlaps.
Yeah.
So social isolation is a risk factor for loneliness, but you can be socially isolated, living alone, and not lonely. But of course, you can feel lonely and be surrounded by people, as Roger was saying as well. And one of the difficulties is the measurement of loneliness. Loneliness is subjective. It's a subjective experience. So you're not going to know if somebody's lonely unless you ask them.
Yeah.
And so the person has to volunteer that they feel lonely. And there are ways to measure loneliness, but oftentimes there's an overlap between how we measure loneliness and how we measure isolation. And this causes confusion, I think, in the field, particularly among healthcare professionals. So which is more important? I mean, I think they're both important. My gut feeling is that loneliness is more important and is more impactful in terms of health. However, they are both important in terms of health and health outcomes. So while we should ask about loneliness and the quality of social relationships, we need to also understand about people's networks and how many people they meet, how many people they're in contact with, because this is important in terms of figuring out what we should advise them to do. And it's very interesting, and I think Roger has alluded to this, when you look now at modern society, we've never been more connected, digitally perhaps, but when you look at relationships, the number of friends that people have, particularly in high-income countries, is actually falling off very significantly. How many real friends do you have?
Yeah.
It's falling very significantly, and I think this is a factor.
It's increasing for younger people.
Absolutely.
And just the other item that you mentioned there, the digital revolution has made communication easier, but it hasn't made connection easier. Or I don't know, is that the right word?
Yeah. In America, there was a survey undertaken, and 29% of people had 2 or less friends. 2 or less friends.
Yeah.
That's, in terms of a risk strategy, that's one that's important to think about with regard to across the life course.
Because, I mean, if you've only 2 or less friends, I mean, who are you going to confide in? Who can you trust? And of course, that's going to contribute to emotional loneliness. It does seem, if you look at the development of society, if societies are becoming much more individualistic. And in the old days, centuries ago, everybody lived together, collectively. But now more and more, there's a push towards people living on their own. And the rise in loneliness seems to be directly correlated with people living alone and this more push towards more individualistic societies. There's an issue about loneliness on an individual basis, but you also have to look at systemic issues and, population level issues and how society is developing and changing.
Yeah, if you think about the rise of the single person household, you've seen that over the last 50 years in Ireland. But on top of that, it's not just living alone, it's actually living alone not by choice. If you want to live with others and you're living by yourself, we need to think about. And we need to just reflect on how do we design our society to make it more connected? Because so often, Fergal, the way society is developing is designing out connections.
Right. Making it easier and quicker, but not deeper.
Yes. Relationships have become transactional.
Yeah.
Increasingly transactional. If you think about it, you can sit on your sofa. You can make phone calls to order your food to be delivered to your door. You can buy your insurance online. You can have everything without leaving your house. Now, the challenge with that is connections matter. Think about during the pandemic, how we all noted that loss of those everyday connections. that impact upon our social well-being.
Yeah, there was so much dialogue about the missing pieces during COVID. And have we remembered or have we forgotten too quickly? We got this gift when we got married, and I don't know who it came from. Like, it came from without a note or something, but it was like a framed picture of it's in the shelter of each other that the people live. It was, and that just saying is an old Irish proverb. I never heard it before or since. But we have it up in the house, and I don't know who it came from, but I often think of it that a community is a necessary support system that we seem to appreciate during COVID. But have we remembered? And that was like, not that long out of COVID. What's your thoughts on that?
Brian and I worked on an article along with our colleague Jerry Levy called "Will the Pandemic Help Us Reframe and Rethink Loneliness?"
Okay.
So the pandemic increased awareness of loneliness, and it brought traction for a certain period of time. But other issues come in since then. And I think that's the challenge of keeping the issue of loneliness. And I also think that the social health part and its impact on its associations with our health and well-being can easily be forgotten.
One of the things that we noted during the pandemic was the impact that isolation had on people living with dementia and on their carers. And what isolation does, and the increased risk of loneliness, it impacts on cognition. And what we found was that people living with dementia, because of the isolation and the loneliness, their cognition deteriorated, and they deteriorated more rapidly during COVID. And I think COVID taught us a lot of lessons. It taught us what the impact of isolation and loneliness is on our health, but also on our brain health, particularly on our brain health. And I think if we've learned anything about this, we have to really push even harder to support and maintain community at an individual and at population level, because it's so important for brain health and for mental health. So we have learned harsh lessons, but we have to act now in terms of building community and to address this, what we call this terrible disease of loneliness, which really does impact on health, and particularly on brain health and mental health.
I was really impressed with the Understand Together campaign that the HSE have gone in relation to dementia. It's about taking a community approach, supporting supporters and allies at community level. So when you see it in action and you hear the stories from the communities, it really is enriching the most important part of the support system. Like, if the community responds, and I just heard my own parish priest recently talking about making, a dementia inclusive community, and I thought that he's got the language, he's using it. There's a cafe for older people and people with dementia in the town, and it's fantastic to see those supports. It's easy talking around the table about it, but when you see them landing in your own backyard, impacting on your own family, it's really rich stuff that gives you a bit of inspiration.
I guess one of the most important messages of the Understand Together campaign for people living with dementia was inclusion.
Yeah.
And making sure these people living with dementia are included in society, in their communities. And that obviously would address the risk of loneliness, because people with dementia, living with dementia, often feel lonely. They tend to withdraw. There's a lot of the self-stigma, but there's also stigma from outside. The only way to combat that is to be more inclusive. And I think the Understand Together campaign addressed that head on, and is really, really important. And you can see how it can protect the brain health of people living with dementia if you feel included.
Yeah, that's a massive risk. That happens with a lot of stigmatized issues, that you withdraw and you increase the rate of the illness.
Of decline, yes.
Yeah, that's interesting when you put it like that.
Yeah, if we think of the example of hearing loss.
Yeah.
So hearing loss, it affects your being able to connect and take part in conversations. And that's, if you think about a very simple action that people can take, is to get their hearing tested. And that facilitates being able to connect.
And stay connected, yeah.
Stay connected. But also it's to do with the issue of loneliness. Because if you are unable to connect, then you're more likely to be lonely.
You're more likely to withdraw and become lonely. That's an intervention on an individual basis. But going back to the issue of design, I think is a very interesting topic. And how do you design to mitigate loneliness? One of the things that's happening more and more now is the so-called lonely deaths. People are dying alone. I see this in Japan a lot because of their aging population, a very old population. So a lot of people are dying on their own, and they're not being found for days, sometimes weeks. And we need to address this in a way of designing to address loneliness. So how do you design? How do you create living environments where people are more connected, less isolated, and become less lonely? They have a number of innovative approaches. Let's say in Japan, there's a tower called Nagaya Tower. And in this tower, what they've done is they've brought generations together. older people and younger people. And they've taken away the kind of the barriers of the balconies so that people, if they go out on their balcony, they actually interact with their neighbour. And they've also designed it so that if you come out of the elevator down the stairs, you actually come into an open space where you have to meet people. So this is a rather innovative way to design so that you can actually decrease the risk of people being isolated and lonely. You talked about dementia cafes or Alzheimer cafes, but designing cafes, in buildings where people can come together, improving transport. So particularly for older people in rural areas or even urban areas can get together. All of these things are really, really important in terms of mitigating the effects of isolation and loneliness. So I think we have to be a lot smarter about how we design our environments, our living environments, but also our urban and rural environments to actually mitigate against loneliness, because it's such an important health and social care issue.
Yeah, it's important to think about those structural issues that Brian's talking about, where we live, our communities, how we work, and designing in connections. So if you think in terms of the rise of single-person apartments, but actually designing in spaces that people connect. That's a great example, Brian, about coming out of the elevator, that you're then connecting. But also, it's maybe intergenerational connections.
Mm-hmm.
If you think about, in today's world, how many people have friends of different generations? How often do they connect with people of different generations? So if we go transport, housing, green spaces. So we've got walkable cities. What about connected cities where it's easy to connect? If you're, say for example, Fergal, you maybe go to Scandinavia, you're by yourself, you go into a restaurant. There might be a table there for people who are eating by themselves, but they want to have a conversation with others. And it's the conversation table. We think about walking groups, history groups, building in connections into different aspects of public health.
There's a growing appreciation that those protective factors, I suppose we didn't maybe appreciate those protective factors enough. Some of them, we grew up with them. We saw them for the topic. Like you mentioned there, like a walking group or a local historical group. I want the lads that are interested in that, and the ladies are they're the historical guys. But they're not realising the protective factors that they get out of getting engaged in a hobby or getting engaged with other people. So it could be anything.
Yeah, Brian was involved with a volunteer randomised control trial. And I was always struck by what you found.
So this was a study we did a good number of years ago. We called it Only the Lonely. And we trained up these volunteers to visit people who were lonely, at risk of loneliness. And we randomized 100 people. 50 got the intervention, 50 didn't get the intervention. Some very interesting findings over the course of 8 to 12 weeks. So those people who got the volunteer intervention, and it was just once a week for about an hour, those people were less lonely, less sad over that period of time compared to those people who didn't get the intervention. But one of the most interesting findings was that the volunteers themselves, actually, over this period of time, their loneliness levels dropped as well. So there was a benefit to the people who got the intervention of the volunteer, but there was a benefit to the volunteer of this pro-social behavior. So you see that by providing a connection for the person, but actually you're providing a connection for yourself as well. This pro-social behavior decreases your own level of loneliness. And we know that loneliness itself actually decreases your empathy levels. And if you can decrease loneliness, you actually can improve empathy. So there's a lot going on here in terms of benefits to the person.
Yeah. It kind of feeds into that stereotypical, that man up the laneway might be angry and he doesn't welcome that engagement, where that might be, as you said, might multiple benefits, but may change his take, his reality.
One of the things about loneliness, which we haven't talked about up until now, is particularly chronic emotional loneliness, which could be that man up the street or up the lane, is that when people are chronically lonely, even though they crave an improvement in the quality of their social relationships, they've become mistrustful,
right,
or hypervigilant. So you may misinterpret that angry old man or who is lonely, that anger, or that maybe a sort of a pushing away, kind of hypervigilance or mistrust, which is part of the emotional loneliness. So one of the things that we realize in working with people who experience chronic loneliness, emotional loneliness, is that you have to be aware of this hypervigilance and mistrust, and you have to overcome it. So as a healthcare professional, just saying to a person who's lonely, go do this or go do that. They may nod and say, okay, I'll do that. But in fact, because of their own hypervigilance or mistrust, they may not be able to. So that's where, going back to that randomized trial, where we trained the volunteers to be able to overcome this barrier.
Yeah, it's a significant barrier then, yeah.
And once you get through that, it opens up.
Yeah.
But you have to be aware of that mistrust or that hypervigilance, which is a feature of the emotional loneliness, which could be there for years.
Yeah.
And you must try to overcome that. And that's where that interpersonal relationship is so important. It's very hard to do that over the phone or over Zoom.
Yeah. I suppose that it reminds me of some of the social prescribing relationships that our social prescribers have, that you get to spend time, and trust is the key element to do an onward referral. You're not going to trust somebody to go somewhere else or support them to get somewhere else unless you, as you said, get over those couple of stumbling blocks. There's a vulnerability there. The vulnerability might be disguised, is what you're saying. So you have to see it for what it is.
Yeah, Brian touched on chronic loneliness, and that really is about the different frequencies of loneliness. So there's different frequencies. One's like transient loneliness, and that's maybe experienced the times of bereavement, retiring, moving home, becoming a carer, maybe going to university.
A significant transition.
A transition. Situational. It could be Christmas. It could be the pandemic would have been a situation we're in. Occasional is just a feeling that comes and goes. It's often said it's a natural part of feeling, of being a human. But from working with Brian, what I observed over the years, before you jump to action, and people often jump to solutions. So, Fergal, this is what you need, but you have to understand, define the problem. Is it loneliness or social isolation?
Yeah.
The next stage is, what type of loneliness is it? Is it social loneliness? Is it emotional? Is it existential? And then from there, well, how frequent is it? Is it chronic? Is it just because you're in this situation? And it's that stage, after you get through those different hurdles, do you try to work out, so what's the root cause? And that's how you identify the solution. So often when people are designing programs to support people who are experiencing loneliness, they don't get the outcomes that they want, because it's important to start with those couple of questions. A bit like if you went to your doctor and before you said anything, they went, oh, this is the answer. This is what you need. It's bringing that back and understanding it and hearing where the person's at. Often people don't think about the social determinants of loneliness, because finance may be an issue that impacts the choices, which may impact your ability to connect with others. I was involved in a global study that had over 20,000 respondents from 101 different countries. And we looked at the risk factors for loneliness and social isolation before the pandemic and during the pandemic. And the two that stood out was insufficient finances and poor mental health. So those are the two global, across all those countries, that stood out as the two most significant factors.
Yeah, and they can remind me of that pulling back that you might do. If I don't have sufficient funds, I have to stay out of the community that's trying to sell me things. If I feel concerned about my mental health, or there's a stigma around that, unfortunately, still, that we're trying to break down, I'm literally withdrawing. So you're putting that burden of, I'm increasing my potential for social isolation and loneliness because I feel like I'm othering myself.
So one of the interesting issues for loneliness is that it's a risk factor for depression.
Yeah.
And it's commonly associated with many mental health conditions, but particularly a risk factor for depression. And I'm just reminded of a story I often tell about a patient, and this is my aha moment for understanding loneliness. As many years ago, a person was referred to me, a widow, by her GP, and she had been diagnosed with treatment-resistant depression. She'd been depressed for about 2 years, and it all seemed to start following the death of her husband. She'd been through multiple therapeutic trials of medications and psychotherapy, and I was asked to see her because of this resistant depression. But in fact, in talking to her, it became clear to me that there was something else going on. This was not just a straightforward depression. She was depressed. There was certainly depressive symptoms, but the big issue was this emotional loneliness that she was experiencing following the death of her husband, because they'd done everything together as a unit over the previous 40 years, and she just wasn't really able to come to terms with the loss of this confidant, this somebody to talk to. So it was just unpicking that and then actually saying to her, but I said, do you feel lonely? And she said, no, I don't feel, what are you talking about? And then she came back to me subsequently and said, you know what? You're right. It is loneliness. It is loneliness. So she was able to eventually acknowledge the fact that loneliness was driving her depression, her depressed mood. And it was only by coming to terms with the loneliness and been trying to address, how do I tackle now this loneliness which has occurred following the bereavement, that she was able to begin to live her life again, and also her depression improved. I think, as Roger was saying, it's not one size fits all. You have to take a deeper dive. You have to understand the quality of the person's social relationships, their connections, whether they're lonely or not. Oftentimes, if you're trying to help people who actually have some enduring mental health issues.
One of the things about working in this area is you discover that you can only find out if someone's lonely by asking them. That's really important. And Brian, a story that I have reflects that story about the widow. I was chatting to a friend and they said, my mother is so lonely. Her husband had died 6 months before, and she says, I don't understand why my mother's so lonely. We're always around her and the grandchildren's always around her, but she's so lonely. So it wasn't a social loneliness she was experiencing, it was an emotional loneliness. So that's why, and it's a very different type of action and support that's required. But Fergal, can I ask you, in your world, do you think there's a stigma if someone would say they're lonely?
I think so, yeah. It seems to me, from listening to you and from other conversations I've had on the podcast, that in order to get an understanding of loneliness supports, you have to create a trusted space for the person you're working with, or the person that's using your service. You're getting to their vulnerable place. You build up trust and you get to that level of vulnerability where you can get somebody to say, yeah, I am lonely. But I think in modern society, as I see it, loneliness is could be perceived as a failure of social connection. And so if I'm lonely, I'm not going to shout about it or tell many people, because I feel like I'm doing something wrong here.
The perception it's a sign of weakness. What has that person done wrong that they're lonely? And that's part of the issue, that really challenging the stereotypes and the stigma would be such an important piece of work that government could do.
Yeah.
If you're lonely, who should you talk to? What can you do? But also, there's a perception on who is lonely, and that's what the pandemic really changed. Because often the perception, as you said, it's that older person living by themselves up a long lane, and they may be lonely. But if you look at the most recent CSO data, over 15% of people aged 16 to 24 said they felt lonely. 16 to 24.
Right, that's very young.
Yeah. So that's the issue of, we often think of loneliness being an issue of older age, but actually it's younger age groups that are also lonely. And if you think back to that different stages, transient loneliness, change in position, moving from new jobs, moving house, all those changes, working long hours, or it could be spending too much time on social media. But it's important just to think about, when we're talking about loneliness across the life course. Say, for example, an employer like the HSE, large number of people employed, a percentage of those will be lonely. And recognising that, and as employers, what's the responsibility of employers to do in terms of loneliness?
I think Roger raises a very important point about professional loneliness. So we've been talking primarily about people living in the community, young people, older people, middle-aged people, but there is a rise in professional loneliness for people at work because, again, this push towards more individualism. People often are feeling more isolated and lonely at work, particularly if they're in leadership positions. And I think we have to try and combat this tendency towards individualism and this rise in professional loneliness, because if you're feeling lonely at work and you don't have people you can trust or talk to, or you don't feel that you have that, you're at increased risk of having burnout. So I think loneliness can appear in many different forms and in many different places, and professional loneliness is certainly an issue. We do see this among healthcare professionals, among doctors as well. The days of the common room in the hospital is gone. Doctors now are faced with very, very difficult decisions, mostly made on their own. Oftentimes you don't find someone that you can have a curbside consult with and get advice from. So this puts huge pressure, and this feeling of loneliness at a professional level. It's important that we talk about this too. This needs to be addressed. There is that risk of, people working from home as well, feeling more lonely because they will not have that social connection, that face-to-face connection, those people to talk to support, and so on. So acknowledging that and being aware of that sort of the modern trends post-COVID that may contribute to or increase the levels of loneliness. We have to be aware of that and find ways and figure out ways to address it.
Yeah, there's so many complexities here. I'm taking with your point there, but I suppose overall the theme I'm getting is that loneliness is a complex issue. There's a number of strands underneath this, number of causal factors are interacting, and modern society isn't organically supporting us around loneliness. It's pulling us away. So we have to design in support systems and design in protective factors that we know historically that we've leaned on, didn't call them loneliness. We didn't have a loneliness strategy. But now we really need to all hands on deck. And in terms of that, engaging with people at whatever, like I know a lot of listeners to the podcast may be, members of the public or people working in the health or social care arena or at community level, that they may be interacting with people. But it's not, maybe that's just that stereotyped person that we've named the stereotype, but like there's a plethora of different reasons and rationales behind the loneliness feeling. Am I getting that?
Yeah. In today's world, do you take time to build your social connections and your convoy? If that's a message coming out, someone can say, I heard this great podcast today. I talked about loneliness, and they can use that as an opportunity to say to someone, have you ever felt lonely? Just to start that conversation. Maybe in organizations, they can think about what are they doing to help support connections. And at a government level, again, what are they doing to support connections? So just reflecting on those parts. If you think we're often very busy doing rather than connecting, and working from home, you don't get that chance for that cup of tea conversation, the water cooler conversation, just on the side, how are you doing? Because you go in and out of Zoom meetings or team meetings and it starts. That's the advantage of face-to-face. There's a great quote, and I'm always struck by it, that says, treat loneliness like hunger, thirst and pain. It's a message from your body that you need to take action.
That's good. Your call to action, as you're just saying there, is to consider your support system or consider other people and consider putting time into supporting your support system.
Completely. Be the person who makes the call, who invites other people out for a coffee or a walk. Be that person. Don't wait on the call.
Okay.
That's very true. I mean, there are different levels of intervention. Roger spoke about the sort of systemic interventions at a population level. We talked about transport and trying to make Ireland and our community more connected. People understanding the importance of connection for your health and well-being and the damaging effects of loneliness. I think that's a very, very important message that people, loneliness is a painful, negative experience, but why should you change it? Well, because it impacts on your well-being, on your health. And then you've got to think about people who are at risk. We know there are many people at risk, people who are bereaved, people who have physical health issues, caregivers, people with mental health issues. These are people who are at risk of loneliness, and being aware of that, we can make an earlier intervention to try and prevent. But then for people who are lonely, there are interventions. There are forms of talking therapies, activities, social prescribing. All of these have been shown to be of benefit. So there are things we can do at the prevention level, but also at the at-risk and the intervention level. But we certainly need more research. We need to develop more effective interventions. But one thing that's been on my mind really about loneliness is reframing or rethinking loneliness. One way to rethink it is to say, well, okay, it's a social issue, but it's a health issue. I think that's important. But also, loneliness itself, the word, has very negative connotations, and maybe we should flip it a little bit more and talk more about connection and the importance of connection and connected community and inclusion, which combats loneliness. Because words have meaning for people, particularly young people. And as Roger said, people aren't putting their hands up saying in school, I'm lonely. But, if they say, well, let's look at your connection, let's look at your interactions, your relationships, let's talk about that. And let's talk about how that could impact on your health. That's a more positive message, I think, and perhaps a message that might get more conversations going, because I think that's really what we have to do. We have to have more conversations about this topic before it becomes an illness and a disease, because it's all about prevention and rethinking, reframing it, I think from the perspective of connection.
Connection. It's in the shelter of each other that the people live.
I always think the first part is to raise awareness and to identify that loneliness, social connection, social isolation are important issues that we need to consider. And that's really the first part of the recognition, defining it, and then from there, trying to work out, at the very start we said, it's a very personal issue. And it's trying to work out Is 2 friends enough for you? But 5 friends isn't enough for someone next door. So it's that idea of, do you get energized from other people or do you energize yourself? And so it's trying to see what's the patterns and looking at the different groups. But over my time working in the area of loneliness, it's an issue that continues to challenge me. Say, for example, on the issue of frailty. Evidence shows that actually it used to be that you would think frail people became lonely. And the evidence now is showing that actually lonely people can become frail.
Right. Different way of thinking about things.
So it's a different way, and it's saying this is a significant issue. Whatever we call it, we need to take it serious. And we need to think about our social connection.
You can have different considerations. Like sometimes I think Christmas is nearly an excuse sometimes to call in to the neighbour that you don't regularly call in on, but you can call in and say, "Oh, happy Christmas, we haven't seen you all year," or whatever. But in that January, February time, I think that can be a very vulnerable time. The bleak winter, it can be just bad weather time. And it's nearly more important, I think, sometimes in terms of that connection that, even the weather can impact on our mood, I suppose.
It's back to that issue of looking at what needs to happen at the individual level.
Yeah.
So that individual level support, the community support, and then the wider macro support. And I think that's really important. So one of these actions isn't going to change by itself. So there has to be a whole society view of how we're going to tackle loneliness. Ideally prevent it from happening in the first place or reduce it, focusing on those groups that are most at risk. But it's most certainly raising awareness. And that's what I think a podcast like this is about, raising awareness and someone saying, yeah, that makes sense. That's what's going on.
Yeah. We'll have to wrap it up soon, but for the listener's point of view, we'll put in the link to the Understand Together campaign, and we'll put a link into the Global Brain Health Institute in Trinity, and we'll also link to Roger's Institute of Public Health website. But in terms of closing thoughts, I think you kind of summed it up very well there in terms of the connection. Is there anything else you want to say, guys?
Well, the only thing I would like to say is that from a healthcare professional point of view and a doctor's point of view is that the importance of the social history. In the old days, social history was, are you single, married, divorced, do you smoke or drink? That's not enough. We need to have much more detail about the quality of the person's social relationships and their connections. This is really important in terms of looking at the risk of the individual to their health, but also in terms of planning interventions for a person who is at risk of loneliness or is lonely. You can't really prescribe interventions unless you really understand the quality and the quantity of the person's social relationships. So that's my call to action for healthcare professionals. The social history is more than do you smoke, drink, and are you single, married or divorced?
Thank you. Roger, any final thoughts?
I'm just going to touch on the famous Take 5.
Okay.
Connect with others. Spend time building and developing your connections. Be the person that reaches out. If you can, be active. Walk, garden, connect with others, and then find something that works for you. Take notice if you're feeling lonely and listen to your body and take action. Keep learning. 2026 is a chance to learn a new language. It's to learn how to paint, learn how to dance, learn how to reconnect with others. And finally, it's also a chance to give, because volunteering, we know from evidence, helps other people, but it also helps you.
It's a win-win.
It's a win-win.
Okay. Thank you both for contributing today. I really appreciate it. Thank you to Roger O'Sullivan, Director of Ageing Research and Development with the Institute of Public Health, and Brian Lawlor, Professor of Old Age Psychiatry and Founding Director of the Global Brain Health Institute at Trinity College Dublin. Thank you very much for contributing today. I'd like to thank the listeners for tuning in, and if you would like to share this episode, please do. We'd really appreciate it if you share wherever you're listening to this podcast, whatever podcast channel, please share it with anybody you think would get value out of it. And you can also find out more about HSE Health and Wellbeing from our website, on the HSE website, and on our LinkedIn channel and our channel on X. And if you want to join our mailing list, please send us an email at healthandwellbeing.communications@hse.ie. Thanks for listening to another episode of the HSE Talking Health and Wellbeing podcast.